Well, the basic anatomy of the knee is actually quite complex. I've got a simple model here which shows the bones and some of the ligaments. This is the thigh bone or the femur, this is the tibia or the shin bone, and this is the kneecap or patella. The structures in blue are the meniscus or cartilage. In the middle of the knee, deep inside the knee, are the two cruciate ligaments. There's the anterior and then there's the posterior cruciate ligament. And either side of the knee are the collateral ligaments. This is the medial collateral ligament and the lateral collateral ligament. Combined, they provide stability for what is essentially a very unstable situation. In the hip joint, you have a ball and socket, which is inherently very stable. And down at the ankle, you have a mortise, where you have bony structures surrounding the joint, which again make it very stable. Connecting these two is the knee, and it has to provide rotational movements, as well as backwards and forwards movements, and the bending action as well. The winter sports injuries we see mostly in the knee are to the medial collateral ligament. This occurs about 40% of the time. And then there is the anterior cruciate ligament deep in the knee in here. And then there are the cartilages or the menisci, and they're far less frequent. Fractures around the knee are relatively rare. Historically, fractures were very common, and before advances in bindings, they were the main injuries seen on the slopes. With improvements with equipment, about 1% of the injuries we see are fractures, and they mostly occur in the more elderly, experienced skier where the bones are getting a bit softer. How vulnerable is the knee during winter sports? Extremely vulnerable. As I mentioned, the structure and function of the knee make it a very inherently unstable situation. Unlike the hip, which is the ball and socket, and the ankle, which is a bony mortise, the knee is a balancing act between two bones. And to allow it to have the range of movement inherently makes it more vulnerable to injury. When you look at comparing skiing and snowboarding, snowboarders have a greater risk of injury. But in terms of knee injuries, the risk is much higher with the alpine skier. And shoulder injuries and arm injuries are much more common in the snowboarder. They're approximately twice as common in the knee with the skier compared to the snowboarder. Although snowboarding knee injuries are less common, there's a particular pattern to these. They tend to occur whilst one leg is on the board and the other one is off the board, such as on the button lift or a T-bar or dismounting from a chairlift. The differences between the ACL and the MCL are essentially structural. The medial collateral ligament is a long, thin structure. It's actually more than one structure. It's three structures combined, whereas the anterior cruciate ligament, deep inside the knee, is a more cylindrical structure, and it works with the posterior cruciate ligament. All the ligaments around the knee work synergistically to provide stability in various phases of movement. Comparing a sprain with a strain when it comes to injuries in the knee is a little simplistic. I would rather put it in terms of the degree of injury, and we can break it down into essentially three types. These are tears of the ligaments. There's a type 1, which is a partial tear which doesn't destabilize the knee in any way. There's a grade 2 where there is some increased movement due to the injury, and a grade 3 where the ligament is completely ruptured. Paradoxically, the more severe the injury, the less pain is produced, because once the fibers are all ruptured, there are no nerve endings to provide the stimulus. Specifically in terms of protecting the knee against injury, unlike snowboarding, you can't put pads or anything around there which will protect you from a severe twisting injury. There are braces available, but these can be cumbersome. There are some symptoms which may be overlooked in a serious knee injury, and I can call these the red flags. An obvious deformity requires medical attention. If the knee swells up within 2 to 3 hours of the injury, it's very likely that you have an ACL rupture, or you may even have a fracture. This is due to blood collecting in the knee. If you can't straighten the knee, it's described as locked, and again, this could belie a serious injury or a cartilage tear which has become jammed in the front of the knee. Any swelling outside of the knee can infer a serious injury where the lining of the joint has become ruptured and the swelling is tracking into the lower part of the leg. Any bruising appearing in the back of the knee or going up into the thigh could indicate a complete hamstring rupture. And an inability to walk for more than 2 whole steps is also an indicator that medical attention should be sought. Do patients come back unaware of having a serious knee injury? Historically, maybe, but most resorts now have very good medical facilities, and patients are usually returned home with a diagnosis.